All right, it's 12:30 on the dot. I'm going to go ahead and get started. Hi, everyone. Thank you for joining us today. Today's cancer care virtual seminar topic is Let's Talk About Lymphedema. My name is Annie Gebbe, and I'm an outreach coordinator for the Samaritan Cancer Resource Center, and I will be your host and moderator today. This event is brought to you by the Samaritan Cancer Resource Center. We partner with anyone touched by cancer to provide the support they need to live with strength, determination, and hope into the future. This presentation is being recorded. Just so you know, all of your microphones have been muted and will remain muted during the session. Please use the question section to to ask any questions or to put any comments, and I'll keep track of that during the webinar. Just so you know, I will be answering or giving the questions to Cindy and Lisa at the end, so we can go over that. So there will be time for all those to get answered. Joining us today are lymphedema specialists Cindy Davis and Lisa Goodrich to discuss lymphedema prevention, risk, and management. Cindy and Lisa, hello. Thank you for being here today. I'm so excited for, in honor of Lymphedema Awareness Month. We are very lucky to have you here speaking on the topic. And without further ado, I'll turn the presentation over to you.
Thanks, Annie. Yay! We got Lisa too. Yay! Okay. So Lisa and I obviously work here at the Stega Regional Cancer Center. And Lisa and I basically have the same role here. We are here to provide not only lymphedema services, but also support during your journey. So with these presentations, we just sort of like to talk about the basics of what we do. We like to talk about what is lymphedema, how do I reduce my risk for it. These are some of the things that we'll talk about if we see you after your surgery. And please keep in mind when we talk about lymphedema, for your specific situation, it's going to depend on what part of the body you're being treated for. So if you've had breast cancer, obviously your lymphedema risk is in the area you've had your surgery or radiation. If you've had head and neck cancer, that would be the area that we would be addressing for you. Lower body lymphedemas, if you've had cancer below the belly button, it would be your legs, areas below the waist. So Lisa, do you want to start with lymphedema? What is it? What isn't it?
So lymphedema is a swelling caused by protein-rich fluid that builds up after you've had lymph nodes removed. When you have nodes removed, you could have 1, you could have 25. So the risk increases with the more nodes that you have removed. So we recommend that you're just careful with that arm or leg, that you don't get finger sticks, blood draws, blood pressure, avoiding tattoos on that side, because we don't want you to get infection, and your infection risk is higher after having those nodes removed. Lymphedema is swelling. It's swelling, but it's not swelling like, oh, my ankles are swollen after I sat for a long period of time, or my hand is swollen because I just walked 10 miles with my arm hanging down.
Or I sprained my ankle,
yeah.
and that's not lymphedema.
Yeah. We can take care of that. And nowadays they remove fewer and fewer nodes than in the old days. So if grandma had a swollen arm, that could be because they removed more nodes back then. But we teach you about risk factors. We teach you what you can do to prevent it. Sometimes it's compression sleeve, exercises, decongestive massage. We decide though when we see a patient, because every one of us is different. So we base every program on you as an individual.
And again, we'll like Lisa's saying, we'll
Mhm.
customize your treatment plan in relation to what surgery you've had, how many lymph nodes have been removed. A lot of people that we see post-surgery, sometimes it's a one and done scenario. And really what we are looking for is, can you reach? Do you have full range of motion? Is there scar tissue we need to work on to help you get your range of motion back? We like to answer all your questions about your lymph system in specific and give you a really good comprehensive long-term plan. One of the things about lymphedema risk that is very misunderstood is that it's a long-term risk. If you've had 2 or 3 lymph nodes removed, you will always have 2 or 3 lymph nodes missing. So the precautions that we talk about, trying to avoid injury to the area where you're missing lymph nodes, that's a forever precaution. So I always encourage my clients to be as proactive about that forever and be your own advocate. We can't tell you that one injury is going to cause lymphedema. It probably won't, but we don't know. I always tell people, if you have 100 injuries from today to the end of the world, would one of those injuries create a permanent lymphedema swelling situation for you? Nobody knows that. So ultimately, really, we tell people it's best just to avoid the things that you can avoid. We can't avoid everything. So if and when you were to have an injury in the area where you had lymph nodes removed, you want to keep it clean, keep it covered, keep your antibiotic ointment on it. And again, we will, if we see you in our clinic, we will give you a very specific to your anatomical situation picture as we can. Let me close that. Sorry, my computer's doing things here. So Lisa and I are here to treat lymphedema if it happens. We prefer to help you know how to not get lymphedema. That's really the ultimate goal, is we don't want you to have a chronic condition. We want you to get through this journey as functional and pain-free and happy as you can, as you can be. And you can. We can help you get there. And of course, we are here also, and this is where we can talk about some of the things that aren't specifically lymphedema, but some of the things that we can help you with as well, which reminds me, lymphedema is swelling, right? And it's usually swelling in an area where you have lymph nodes removed. It could be the arm, the hand, the breast, anywhere in that quadrant. One of the myths of lymphedema is that it's horribly painful. Lymphedema itself is not horribly painful unless you have an underlying condition. For example, if you had fibromyalgia, my shoulders always hurt, my arms always hurt. If you have an underlying condition and then you develop swelling in that area, yeah, it could increase the pain symptoms that you're having in that area. But lymphedema in and of itself is not, it doesn't have a pain component to it. It might feel weird. Some people say it feels different. It feels
Heavy
or like it's
tingly or
crawling. These are the things people tell us, that it just feels weird.
Yeah.
But it's not per se pain. So if you all of a sudden had significant swelling and pain, we are always going to ask the doctor to see you and do an ultrasound to rule out other things first. So that's one of the myths of lymphedema.
It does not hurt.
It doesn't hurt. If you also have pain, there could be some scar tissue. We talk about cording all the time. There could be scar tissue happening as well from the armpit up into the arm maybe. And that's scar tissue that we can help with as well. That's usually something that just happens right after surgery for people.
And that's cording or axillary web syndrome, if you've ever heard of that. And it's like a cord. It's like you got a cord and it's not letting you bring your arm up, move your arm, and we can evaluate for that and treat that.
We can get that to reduce just in 10 minutes.
Yeah.
And even though it usually happens right after surgery, from time to time, once in a blue moon, we'll have somebody that comes back to us, maybe even 2 years, 3 years after they're done with all their treatments, and all of a sudden they've got this weird stringy scar tissue. When I reach up, it pulls my arm down. It's just it pulls, it burns. And it's really hard to tell what percentage of people experience that. But if that happens, make sure you just speak up with your doctor about it, and we can definitely help with that. You want to talk about breast pain?
Sometimes after surgery, or sometimes it's just after surgery or after radiation, you can develop breast pain, tightness even. We have lots of techniques that we use to treat breast pain. So you might come in for a 3-week visit with us, and we share all this information, and then, a year later, or 6 months later, or 3 months later, if you finish radiation, you come back and you're like, it's tight and painful. Now, if it's tight, it doesn't always have to be tight and painful, but sometimes you can have both. But we just we do stretching, arm exercises, but we have kind of our magic hand techniques that we can
tools.
tools that we use to loosen that up and to help with getting rid of that pain. So it's not something you have to live with, but if and all our doctors are, hey, you come in and you say, hey, it hurts, hey, go see the lymphedema therapist. Doesn't mean you have lymphedema. It means that we treat more than just lymphedema.
And the breast pain, I have found that oftentimes breast pain happens 4, 5, 6, 7, 8 months after your last radiation session. We can't tell you how many people don't get this kind of breast pain, because we wouldn't be seeing you if you didn't have it, right? So post-radiation breast pain does often catch people off guard, because you're feeling better, you're feeling better, you're feeling better, and then all of a sudden, oh my gosh, where did this pain come from? So it is important to speak up about that. It's not a symptom that you have to suffer with. We have we have a cold laser, a low-level laser in our office that is an absolute magic bullet for breast pain. We find that sometimes it takes 2 or 3 sessions, but you'll experience a reduction of that breast pain just within the first 24 hours after the laser treatment. So again, the take home from that is, if you have breast pain after your radiation, just make sure and mention that to your doctor. None of us want you to have to suffer through something that we're here to help with. And really, that's why Lisa and I are here, is to help you with side effects, symptoms, pain, restrictions after your cancer surgery and treatment, no matter where that happens to be in your body.
Shoulder pain. That's when sometimes people come back to us with shoulder pain. Not sure if it's tightness that causes the pain. Not sure if it's like postural. That sometimes people have shoulder pain, so we'll do some treatment of that. If it's beyond what we can do, we will send you to another therapist who can work on that. I do see patients who get even kind of an impingement of their shoulder, like in the back of their shoulder after treatment. Again, is it just something that you might have had and aggravated by treatment? But we also can work on shoulders, scapula, your scapula at the back. So it's not just in front, it's kind of the whole quadrant we can work on.
And then with the head and neck cancer, if your nodes were removed here, your radiation is right here, your neck might get super tight. You might get swelling, you might be tight, you might have a hard time opening and closing your jaw. Oddly, people who have radiation to the neck, some of them also end up with shoulder issues from the radiation. So again, depending on where you're experiencing your symptoms, reach out to your doctor and see if that's something we can help with. Again, Lisa just mentioned if you were to have, say, a rotator cuff tear or something orthopedic diagnostic wise, that's I will confess that's not my strong point. I'm not super trained in orthopedic conditions. So keep in mind, if you have back pain, if you have a rotator cuff tear, those are going to be things that Lisa and I probably would try to find a better fit for you for a therapist to help with those types of things.
If you are ever diagnosed with lymphedema or are at risk of lymphedema and you are going to have a shoulder surgery,
Yes.
consult your doctor and have your doctor send you to see us first, because sometimes people may not have any issues with lymphedema. They might just be at risk, and then they have a shoulder surgery and it triggers it.
Right.
So it's nice for us to be able to teach you some precautionary things prior to surgery as a just in case.
So again, that scenario is,
Individual.
if I'm missing 3 lymph nodes over here and now I need to go have a rotator cuff repaired, or I need to have a tendon released, or I need a nerve released, I would want to make sure that the lymphedema people are part of that surgery process, because what you're going to want to do is you're going to want volume measurements for one thing before you go into that surgery. And then we also need to be able to see you after that surgery. There are things we can apply to you. We can use sports tape. We can use elastic kinesio tape to help move that fluid away from the surgery so that you don't swell up. We can teach you lymph massage so that you'll know what to do with the orthopedic surgery swelling so that hopefully won't create a lymphedema situation. So definitely, Lisa, that's a really good point, is that if you're at risk for lymphedema and you're going into a surgery scenario in that same area, I would, if it were me, I would definitely want the lymph team as a part of that surgery team. So,
because it's hard when we get somebody back like 8 to 12 weeks after that surgery.
And then they've already swollen to the point that now it's really hard to get that under control, where it would be better for us to spearhead that ahead of time for you. And speaking of that, if you're ever in the hospital for anything, let's say it's time for my colonoscopy. Yippee! Ask for a pink band. This is a lymphedema alert band. This is something that any medical staff person can put on you when you're going to be sedated and you can't speak up for yourself. You can't tell somebody, don't use this arm for my blood pressure if you're under an anesthesia. So these are Samaritan wide. Whether you're in Newport, Lincoln City, Sweet Home, Albany, Corvallis, our entire Samaritan system, has these at our use for anybody. So if you're in for a procedure, definitely, or if you're in the emergency room, ask somebody to put a pink band on you, please. Make sure your medical team from the get-go knows to, obviously, if you had head and neck cancer, you're not going to put that on your neck. We wouldn't be using your neck for any medical testing anyway.
And what it says, if you couldn't read it, alert, lymphedema, no blood tests, blood pressure, no IV or injections in this arm.
There you have it. So all Samaritan systems have these. So what did we miss here?
Well, maybe we'll find out when we have the question.
Yes. Hopefully you'll have some questions. Please know when you ask questions, Lisa and I are not allowed to give medical advice unless we've actually done an evaluation with you. So we can answer general questions, but we have to be cautious with giving you medical advice. Annie.
All right, we'll move on over to the questions then. Thank you so much for that.
Sure.
So just to allow people a couple extra moments to write in questions or comments, I'm going to go over a couple key pieces of information. If you would like to obtain additional information about lymphedema or any cancer resources in general, please feel free to contact the Cancer Resource Center. We can be reached by phone, email, visit the website. You can just walk on in if you're on site for an appointment or just in the area. We're open Monday through Friday. Feel free to come on in either in Corvallis or Albany. We also have Facebook and Instagram now where we're posting updates, so feel free to follow us. We have a couple virtual seminars coming up around the corner. Tomorrow we have Caring for the Caregiver with social worker Heather Peru. And later on in April, we have Health Insurance 101 and Pancreatic Cancer 101. Please subscribe to our newsletter so you can get up-to-date information about what we have going on for events and educational webinars, or call us or stop by to see what's going on. All righty, back to the questions. First up, I have a question. I had extensive abdominal surgery 7 years ago for ovarian cancer, and some, in quotations, para-aortic lymph nodes were removed. My doctor never talked to me about lymphedema, but is it a possibility?
That's a tricky one. So it really depends on, so in terms of the aortic lymph nodes removed, you won't get lymphedema from that. It's really hard to know without knowing, did they remove lymph nodes from your pelvic area? And if they did, which ones? The deep pelvic lymph nodes, if you had really deep pelvic lymph nodes removed, I haven't really seen people get lymphedema from that. It seems to be more if they removed inguinal lymph nodes, or they didn't remove them, but they radiated them. I have seen people get lymphedema in the leg from having radiation to the inguinal or pelvic area. So again, it's really hard for us to know without looking at your op report. But I would say if you only had a hysterectomy without nodes removed, no, no, we don't see people getting lymphedema from that. And deep lymph nodes, again, the aortic lymph nodes, there's really no precaution there. There's really, I've never seen anyone get lymphedema from having aortic lymph nodes removed. So, so probably not.
Okay. Should we suggest they speak with their doctor to get more detailed information about what would...
Yeah.
I think that's good advice. You guys mentioned using a laser treatment. I was wondering if you could talk a little bit more about laser painful? Is it quick? How many treatments? Thank you.
Here's the little laser that we have.
It's cool.
It's basically a light beam. Let me turn this thing on. You don't see, it's not like Star Wars. You're not going to see a laser beam coming out of this thing, right? It's a really benign little tool, but what it does, if I were to put it on my hand, the only thing I'm feeling is this thing hitting my hand. But what it's doing is it's giving a pulsed light beam that penetrates the tissue that's the problem. For Lisa and I, we apply, so if we're applying this to breast pain, we're applying it in an area where the nerves are firing in a pain pattern. And what it's doing is it's penetrating the cells of those nerves to enhance the healing property of the cell, which basically is the mitochondria. So we're literally shooting a laser beam into those mitochondria to help shift the inertia from a pain pattern synapse to a healing pattern synapse. So no, with the laser, you're not really going to feel or see it doing anything, but you will feel the results in terms of reduced pain. Yeah, so it is definitely a different sort of a device. This is something that our wonderful manager purchased for your benefit from an Australia company, and it truly has been a magic wand for people. It helps reduce scar tissue as well. Does that help?
Yes, thank you. I think whenever, at least personally, when I hear the word laser, I think it's kind of intimidating. So seeing
Right.
People do.
device makes it less scary.
Yes.
And then you guys touched on this a little bit. I know there was a lot of talk about removal of lymph nodes during a surgery that can increase the risk. Can you talk a little bit more about how radiation may impact or affect the lymph nodes, and whether or not that's a risk factor for patients to come see you?
So if they're just radiating the breast, that wouldn't affect the lymph nodes. But some people have where they might have had cancer in their nodes, and so they'll choose to radiate the armpit or even up above the clavicle where there are other lymph nodes. And in that case, I think you would be at higher risk because you're getting some damage from the radiation. But if you're just getting it on your breast, then the risk is negligible from radiation.
And interesting. So that's in terms of the breast cancer patient,
Breast cancer,
right?
yeah.
So if we talk about, so in terms of the breast cancer patient, of course, we don't have statistics on this, and
Yeah.
we don't have real good ways to measure lymphatic power yet. So in terms of how much does just radiation cause lymphedema risk, it's not near as much as having lymph nodes removed. So if you've had a couple of lymph nodes removed and then you have radiation, the radiation might increase your risk by 0.5% or 1%. Again, there is no way for us to measure this, unfortunately. I can tell you from an experience perspective, for people who have had cancer below the waistline, for some reason, those people can get lymphedema even if they didn't have lymph nodes removed, but if they did have radiation to the lymph nodes. And I'm not sure the mechanism of that. That's just something that I have noticed through my career.
Also head and neck cancer.
Head and neck cancers.
With
radiation can often cause submental, which is right this area of underneath your chin. Some people get swelling right there from having had radiation. Or sometimes it can be the side of the neck. Sometimes it can come up into the cheek. So it does seem like with head and neck cancers, radiation can have a little bit more of a negative impact on how the lymphatics drain.
Great, thank you.
Mm-hmm.
In the interest of time, just one more quick question. If a patient wants to see you, what's the best way to do that? Do they need a referral?
Yeah, we definitely need a physician's referral because we bill insurance. We definitely need someone to shoot us a referral so that we would know to contact you to schedule that appointment. And that could be your primary care doctor, that could be your oncologist. It just depends on who you happen to be seeing at the time. We also want to make sure we really can only see cancer patients in this building. So people who have other lymphedemas that are not related to cancer, we can't unfortunately provide that service at this time. The other thing to keep in mind, if you've been a patient in the past, we have to follow Medicare guidelines. So if we haven't seen you for 6 weeks, even with that, even if we've seen you in the past, we do need a new referral for that.
Good to know. Thank you. I know
Sure.
clinics run differently, so it's good to know
Great.
hoops need to be gone through to get in. Awesome. Well, Cindy and Lisa, thank you so much for being here today.
You're welcome.
Thanks.
So interesting, and we really appreciate your time. Anyone out there in the crowd, if you have any additional comments, questions, anything like that, please feel free to email the Cancer Resource Center at cancerresourcecenter@samhealth.org. And that is it. I thank you all for participating and have a wonderful day.
Thanks, Annie.
Thank you.